And I think that's part of the wonderful thing about the WHO goal of health care for all. Really, health care for all does not only speak to physical health,
Mm-hmm.
you know, it
Right.
speaks to the health of the whole being.
Exactly.
And to the recognition of the person as an individual, and that each one should have an opportunity to live out a life that has meaning to them. Well, I guess I should say that that the church to which I belong had a strong missionary emphasis, and particularly in the Orient at the time when I was growing up. So I sort of grew up on stories of the Orient, of people, you know, who were coming and visiting in our church and speaking in our church. So I would say that that had a strong influence on my life. And many of the you know, kids I played with as I was growing up were children of missionary families. I have grown up in a community where North Park College, which was the high school and junior college I attended, was just a block from my home. And my church, just a half a block. I have no excuse for not going because it's out the back door and around the corner. And the Swedish Covenant Hospital, about 4 blocks from my home. So I grew up in a community that was very Swedish in its orientation, as far as where the families of this community came from when my folks moved into this area.
It's really not too hard to describe the early years that we had in our home. We were 3 daughters and very close in age. My father always kidded us about, because I was really a very determined person, and I said yes or no about things that I wanted to do. And Virginia was the middle one, and her name was Virginia May, and the youngest one, Maxine. My father would say, well, if Dorothy won't and Maxine can't, the youngest, Virginia May. And we were always kidded about that because Virginia was always a very easygoing and willing person that was very easy to get along with. I always said that she was not only my sister, but really my best friend.
When I finished junior college, I was 18 years old, and you had to be 18 and a half to go into a hospital school of nursing.
What was the rationale behind that, you know?
I guess you were supposed to be a little more mature than if you were 18.
I see,
And you
okay.
couldn't go in until you were 18 and a half, so I had to wait. And I couldn't go in until February. And so I went into nursing in the February class of the class that began nursing in 1934. The director asked us why we came into nursing. I made the comment, I came into nursing because I want to be a public health nurse.
So you knew?
And the director says, that's a very immature decision.
Well, now, why would you?
Saying, I didn't even know what nursing was about. How could I
see.
choose any kind of a specialty field in nursing? But I would say that that stayed with me. Although I enjoyed my time in nursing as a student. When I finished nursing, I knew I wanted to go into public health. I went to University of Chicago, to the downtown school, and I went to school evenings. I worked all day, took the elevated train from Evanston to downtown Chicago, and went to the downtown college of University of Chicago. And I did my 30 hours, most of my 30 hours in public health nursing. If I remember correctly, I started to work at the Evanston Health Department in 1938. And I got my baccalaureate degree in 1946. And it was when I was at the Evanston Health Department that I was that I made my decision to go to Japan. And I left that position at the Evanston Health Department and went to Japan. A very interesting thing that happened to me in my life just then, because when Margaret Denham asked me to go and meet her, I said, Japan? This is the last place in the world I want to go. I was appointed Director of Nursing of the Atomic Bomb Casualty Commission. And we had, I would say, about 40 nurses, Japanese nurses on the staff. And we had also a staff of nurses in Hiroshima, because there was a American nurse who was working there too. The people who came into our clinics were the people who were the victims of the A-bomb. Really, the families who had been touched by the A-bomb. Members of their families had died in many, many instances. But there were people who lived within a certain distance from the epicenter, the point where the bomb was dropped. And they were being examined to see what the effects were that could still be found in the people. We did no treatment there because a relationship was developed with the Medical Association that recommendations for treatment would be made in the center. It was a difficult experience to be a part of, but a tremendous time to be working with nurses of a country that was hurting very badly. And I think if we ever had, a time to show the nurses and the doctors and the people of Japan that there was an interest in helping them out of that horrible situation that we knew so well we had a part of. Those were the days.
Two years ago, Japanese Nursing Association had celebrated the 35th anniversary, and we decided to honor Dr. Ohlson as our honorable member, and the pin she's wearing is that badge. Yes, and because soon after the war, she came to Japan and, dedicated to improve nursing situation in Japan very much. And we thought, we should honor her as our membership. And a special contribution of her to Japanese nursing is improvement of public health nursing in Japan. So, and also she took care of the Japanese nurses who came to United States to receive some kind of nursing education in this country.
Some of the artists.
Yes, we have that.
What's that term?
Kokuho, ningen kokuho in Japanese.
Is that what it is?
Yes.
And what does that mean in English?
That's a national treasure.
National treasure?
Yes.
We sort of feel that way about Virginia.
Yes.
We're very pleased.
I have just really one complete admiration in Virginia. One is not only that the experiences she has had with working with people of differing backgrounds, of course different nationalities, but she has a lot of, how do I say that, inner perspective and sense of what likely could work with different kind of people. Being an international work, I feel strongly that relating with people, for that managing people to be motivated or to go on forward, the incentives are different and the motivations are different. And one must have a real flair to see the best in people, the potentials that you can bring out of people because of certain actions that you know will work with one and will not with the other. And that in itself really is skill and can only be developed with years of working, but can be hastened by an individual who first of all is committed to take people as they are, and that everyone has a worth, and is very important in working with international people. And I think Virginia has it. It's not enough one has to have content, we say. And also, again, Virginia has that admirable perspective of listening. And not only that, but the perspective of that she knows she's not always giving, but is also learning. And again, it's a two-way process in any kind of international work. Because one can, maybe at certain points in time, one gives more and gets less. But this changes at other points in time because one doesn't have the expertise, all the expertise in one, you see. And I think Virginia, throughout her career, I think, has developed this kind of skill. And that does work very well. I think I will not be the only one who could speak to that. Many of her former students, many of the colleagues with whom she worked. You can just, I mean, the recognition that she has received from Japan is an attestation to the kind of work that she had done there and the likely impact that she has had in the formation of many of the Japanese nurses, as well as other nurses around the world that she has had contact with.
When Mary Mullane employed me, she said to me, we will not have a graduate program in public health nursing because I don't think that's a specialty area in nursing.
Oh, really?
And I said, well, if I can't change your mind, I won't stay because I do think public health nursing is a specialty area in nursing. Well,
You stayed.
I stayed, and Mary Mullane became one of the strongest supporters of public health nursing in our college. And so in 1970, we started our graduate program in public health nursing.
Well, I think Virginia has always found a way of getting her work done. And that she is a master at, in a very soft way, of pointing you toward a problem and also toward its solution. And hopefully you'll follow.
We were trying very hard to retain a director for the public health nursing in the state of Illinois. Virginia was extremely helpful and very committed to the idea that we should have someone in that position. And she was helpful in meeting with the group time after time to talk about the kind of person it should be, the job description, how the contact should be made. When we were trying to get money that the University of Illinois had for community health nurses, and we were trying to get it from the state of Illinois, Virginia was very helpful then because she understood the state, she'd been around it, she knew community health nursing extremely well, and again, because she is so diplomatic and so able to see everybody's point of view, and while some of us would get very agitated and want to be a little stronger in our confrontation, Virginia always brought a little message of, now we really shouldn't go at it quite this way, and my recollection is she was just about always right.
I really think I would like to be remembered as a person who valued relationships with my colleagues. Be those colleagues faculty members or deans. I've had deans in my life. Or students, or the secretarial people who worked with me. I think that's hard not to be remembered.